This is the ileum part of the hip bone, and it has three surfaces: the iliac surface, or it is also called iliac fossa, and sacropelvic surface, and a gluteal surface. And it has three borders: an anterior border which starts from the anterior superior iliac spine to the upper border of the upper part of the acetabulum, and the posterior border which starts from the posterior superior iliac spine up to the posterior border of the ischium, and the medial border which starts from the iliac crest up to the iliopubic eminence. And then there is gluteal surface. There are three gluteal line. The posterior gluteal line which starts from 5 centimeter anterior to the posterior superior iliac spine up to the into the front of the posterior inferior iliac spine, and then anterior gluteal line which is the longest line, which starts from the midpoint of the greater sciatic notch up to the iliac crest, slightly anterior to the iliac tubercle. And then the inferior gluteal line which starts from the anterior inferior iliac spine and runs superiorly from the anterior superior iliac spine up to the apex of the greater sciatic notch. And then up to the posterior gluteal line there is the origin of the gluteus maximus muscle, and between the posterior and anterior gluteal line there is the origin of the gluteus medius muscle, and between the anterior and inferior gluteal line there is origin of the gluteus minimus muscle, and below the inferior gluteal line there is the origin of the reflected head of the rectus femoris muscle. And at the iliac surface or iliac fossa, 2/3 there is origin of the iliacus muscle, and then and this sacral surface articulates with the sacrum, and there are three ligaments here: ilio-lumbar ligament, then interosseous sacroiliac ligament, then posterior sacroiliac ligament. And on anterior superior iliac spine there is the attachment of the origin of the sartorius muscle, which is the longest muscle of the body, and the lateral head of the inguinal ligament. And anterior inferior iliac spine gives attachment to the straight head of the rectus femoris muscle, and the posterior inferior iliac spine gives attachment to the sacrotuberous ligament. Yes. And the ischial spine, where there is sacrospinous ligament, and they form greater sciatic foramen. Ends: an upper end and a lower end. Upper end, which is also called the iliac crest, it has three lips: an outer lip, an intermediate lip, and an inner lip. And it has two divisions, two segments: ventral segment and a dorsal segment. And the outer lip of the iliac crest contains a iliac tubercle 5 centimeter posterior to the anterior superior iliac spine, and here there is iliotibial tract, and the tensor fascia lata is originated slightly anterior from the iliac tubercle, and there is insertion of the external abdominal oblique muscle from the anterior at the anterior 2/3 of the ventral segment of the iliac crest, and the posterior 1/3 segment gives origin to the latissimus dorsi muscle. And then the intermediate lip, the whole length gives attachment to the gives origin to the internal abdominal oblique muscle. Here 2/3 of the inner lip gives origin to the transversus abdominis muscle, and the posterior 1/3 gives origin to the quadratus lumborum muscle. And the dorsal segment, it has two slopes: an outer slope and an inner slope. The outer slope gives origin to the gluteus maximus muscle, and the inner slopes gives attachment to the erector spinae muscle.